Thank you. This is a follow-up testimonial. And you went through a very complex surgery, and before the surgery, you were losing function
Yes.
because you had a broken bone. Part of the broken bone was pushing on the spinal cord and on the neural structure. But on the other side, you have some liver problem with the low platelets that we almost canceled the surgery because your platelets number were 46,000.
Yes.
And after weighing risk versus benefit, because we are able to do a minimal invasive surgery, we decided, it's not reasonable to let you go paralyzed.
Right.
We still
No.
took the chance and we
I
did the
heard that.
surgery. Yeah. Now tell me about what were your symptoms before the surgery?
Pain mostly.
Okay.
And I walked around on it for 2 to 3 weeks, and finally decided, well, this is something.
Yeah, but
more
short
than-
before the surgery, actually you
I
quit
had
walking,
some
right?
muscle weakness. And
Yeah, you had some significant muscle weakness, but and then we did the surgery in September,
Yes.
so 4 months ago, and we got a testimonial about a month after the surgery that you were improving.
Yes.
So how are you now?
Much improved.
Okay, and how is the walking distance with the aid and so on?
If I'm in my house,
Hmm.
dry floors, I walk fine.
Hmm.
If I go out, or
You need help when you go out.
I use a walker.
Use a walker. With a walker, how far can you walk with a walker?
Indefinitely, as long as there's no snow and
Yeah,
ice.
yeah. And how is the pain?
I'm sorry.
How is the pain?
The pain is virtually gone,
Mhm.
other than the pain from the fall.
And I just checked you. You can stand up. You can go onto your tiptoes. You can go on your heel. You can bring your knee up, meaning your psoas is all fine. So your strength is almost good. We have some problem with the coordination, but we are just 4 months after that big surgery, after you were practically myelopathic. And I'm going to turn here, show the picture that shows everything is still in adequate position. And you had this piece of broken bone that comes to the spinal canal.
Yes.
And we decided, to take that out, to do a corpectomy with your platelet count. That would be an impossible kind of task. And we
Yes.
decided to stabilize you and do what
And-
we call anatomic decompression. And you are proof that that's working. That is that,
Yeah, well, from what I recall of the last CT, the bone is already resorbing.
Yeah, and once there is no pressure on that, your body gets rid of the whatever it's not necessary there, and your body has a certain capacity to absorb the bone that is no pressure on it. But your clinical symptoms are practically the proof that it's the best way to deal with a situation like that, to go after the symptom to fix the patient rather than try to fix the picture, because your picture doesn't look that pretty. But your clinical symptoms are extremely favorable, and fixing trying to take that bone out would require us to take the entire bone out here with the
Yeah.
platelets of 40.
When the first time I saw you, when I saw that thing, I thought, Jesus, one wrong move and.
Yeah, but I'm extremely happy with the results.
Okay.
Everything is going the right direction.
Good,
You
I'm
are going
happy too.
clinically with the right direction, and again, even in your very extremely unfavorable situation with a broken bone pushing on the spinal canal, even with your platelets count of 46,000, that any other surgery would have been practically impossible.
Yeah.
We could achieve with the minimal invasive OLLIF. We could achieve in the open old-fashioned surgery with the taking the entire bone out and so on, and trying to literally go
Yeah,
from the inside.
well-
That would have been an 8-10 hour surgery.
I've seen that done, went back in medical school and, Jesus.
Yeah, you are a doctor yourself, so you know what I'm talking about.
Yes.
So either way, I think, do you feel that you're still getting better, or
Oh, definitely,
Yeah.
no question. The only thing is should I be getting it better faster?
No, I think we are just on track. If not anything, you are ahead of a track. 4 months after a multi-level fusion and if you remember, your spine was bending forward. You had a kyphotic deformity, which I don't see that kyphotic deformity anymore. So everything is going the right direction. Okay.
Okay, good.
So I'm very happy. So thank you for the interview.
Oh, yeah, you're welcome.